All right, so let's talk about some general concepts of antibiotics, and then let's talk about some specific antibiotics. So some general concepts of antibiotics are that we need to notify the provider of diarrhea, especially with cephalosporins. They're high risk for C. diff. Basically, almost any antibiotic can cause a depletion of the good bacteria in the gut, and then in essence, the bad bacteria, the C. diff, decides to have a party and override the GI tract. So if a person does have diarrhea, notify the provider. Okay, clindamycins are also really common in causing that. When C. diff is treated, it's treated with metronidazole, and sometimes vancomycin is put into that mix also, but metronidazole or the anti-flagellar, we can call that an antibiotic, is used for that. So then in these general concepts, we can also talk about the word bacteriostatic. Bacteriostatic doesn't kill off all of the organisms, but it takes care of most of them. Low-dose cephalosporins sit in this bacteriostatic category. Bactericidal, just like homicidal or bactericidal, these kill off all the organisms. It's kind of a very harsh term, right? Sulfonamides are like this. They're really good for that. Penicillins, we've got to talk about beta-lactam antibiotics and cephalosporins are quite similar. So just keep that in the back of your mind. And calcium, this is a general concept with antibiotics. Don't take them at the same time as antibiotics. In fact, a lot of antibiotics like ciprofloxacin will tell you to take that calcium either 6 hours before or 2 hours after. What happens with calcium and antibiotics is they tend to hug each other, so they hold on to each other as they slide through the GI tract, and it decreases their absorption. So now we're going to move on to the penicillins. Penicillin works, it is a beta-lactam antibiotic. It kind of is this thing that cuts the beta-lactam ring that helps that bacteria, and so by cutting that ring, kills the bacteria. Just know that one of the biggest side effects of penicillin is that it causes diarrhea. Again, notify the provider about that, right? Anaphylaxis is a risk and a rash is a risk. These are really common to cause allergic reactions, and so if there's a rash, we need to notify the provider. If there's anaphylaxis, absolutely stay with the patient and assess the patient, call the provider, prepare to administer epinephrine. See, if we've got an IV antibiotic going and somebody starts getting an allergic reaction, stop the IV, stay with the patient, assess the patient, call the provider. If it's a severe anaphylaxis risk, prepare to administer epinephrine. Epinephrine would be the first thing that you gave, right? And then also know that if somebody's allergic to penicillin, they're allergic to all the cillins. If somebody's allergic to moxicillin, they're allergic to all the cillins. So if you're allergic to one, you're allergic to all. Okay, cephalosporins, many are look-alike, sound-alike drugs, so please be aware. Cephalexin, cefoxitin, cefatitin, they can be easily confused. So they do use this tall man lettering. You can see the XIN and the TET here. The tall man lettering is to draw your attention with your eyes to certain specific parts of the word that might help decrease the risk of error because of the fact that these are all very similar looking in their names. Okay, so another thing I could have included in the general concepts of antibiotics is that lots of antibiotics interfere with warfarin and increase bleeding tendencies, right? Cephalosporins are famous antibiotics for doing this. They may increase the bleeding tendency to those receiving warfarin. The provider may need to reduce the dose of the warfarin the provider is going to need to watch their INR a little bit more closely and all of those things. So it's not necessarily going to cause an allergic reaction to somebody with a penicillin allergy. Okay, and this needs to be changed there. But we still monitor for that, okay? C. diff is a big risk, so if diarrhea starts, the provider will stop the Ceph or cephalosporin and start metronidazole. Okay, and metronidazole is what you're going to be giving to treat the C. diff. Tetracyclines is another group of antibiotics. They oftentimes are used for STDs, acne, tick-borne bacteria. Tetracycline, like demaclocycline, doxycycline, minocycline, tetracycline, these things can cause discoloration of developing teeth. Tetracyclines are very famous for that. Don't take these at the same time as anything with calcium. Antibiotics will decrease the effectiveness of birth control pills, so you need to tell patients about that. If a person becomes pregnant, it can definitely cause discoloration of the teeth for that infant because their teeth are developing. So at any point that somebody's in the development phase of their teeth. Okay, then we've got trimethoprim and sulfamethoxazole. This is Bactrim or Septra. Still on the antibiotics here. If there's a rash, we would need to notify the provider. If there's anaphylaxis, it's still those same concepts. Call the provider and prepare to administer epinephrine, right? It can be nephrotoxic, so we want people to drink 8 to 10 glasses of water per day. Stay well hydrated. Vancomycin is another antibiotic that we talk about. Vancomycin is often used for MRSA, methicillin-resistant Staph aureus. Vancomycin can extravasate. Extravasation would be the leakage of basically blood and the medication out of the vein. But the special thing about extravasation is that it usually involves some kind of cytotoxic medication or a medication that can cause necrosis to the tissue. Okay. Vancomycin can also cause red man syndrome. It can also cause Stevens-Johnson syndrome. It is nephrotoxic. If the creatinine is elevated, you want to talk to the provider. So the BUN and the creatinine are elevated, please talk to the provider. A less nephrotoxic med may be ordered. Fluoroquinolones are another group of antibiotics. They are oftentimes used to treat pneumonia and UTI. Ciprofloxacin and levofloxacin are 2 fluoroquinolones. Do not take these with milk or food. Sorry, I'm going to repeat that a little differently. Do not take these with milk, okay, at the same time as milk, okay? I'm going to say this a little bit differently. They can be taken with food to alleviate discomfort, okay? Let me just pull that up. So food with this is used to resolve that discomfort. But don't take with milk, as the milk will hug the antibiotic and make it difficult for the antibiotic to absorb. Abdominal pain is common, but usually mild and resolved with that food thing. Use sunscreen, as it does make people photosensitive while on this med. The big thing about these meds is that we've learned they can cause tendon rupture. Okay, so no heavy weightlifting while on these meds. People are to report heel pain immediately because the tendon can rupture, Achilles tendon. And so people can get an Achilles heel, right, from that. So we really want them to report if they're having any heel pain. Okay, so some side notes for IV administration. There's something called extravasation, infiltration, and phlebitis. Extravasation is kind of the outpouring from the vein of a medication that is often cytotoxic that can damage and necrose tissue surrounding where it's gotten out. Infiltration. Infiltration is just kind of harmless fluids that have gotten out of the IV and gone into the surrounding tissue. With infiltration, you should feel it would be cool. It would be kind of almost swollen, but it's filled with fluid is a better way to put that. Okay. And sometimes it's a little blanched just because it's stretching the skin so much. The other complication with IVs is phlebitis. Phlebitis is an actual inflammation of the vein, so that too will have some pain associated with it. All of these will have pain associated with them. Phlebitis, though, with it, that one's going to be different. It's going to be warm to the touch, maybe red, and the inflammation would be actual in an actual inflammatory process that is going on. So the swelling will be kind of from that. Then we've got this kind of side note here where it says piperacillin and amikacin are not compatible. How are they delivered if they're both given IV? Well, they're given at different times. Generally, we don't give antibiotics to somebody, two of them at the same time. On a general note, generally they will be timed so that they're given at different times during the day, right? But if these are not compatible, what that means is we cannot hook the two IVs up at the Y site if they're not compatible at the Y site. So they would need to have separate tubings. We can't be using the same tubing, right? And so if something's not compatible, we would use that separate tubing. If something was compatible, it could potentially run together via the Y site of an IV. Okay, then we go to the azole antifungals. Miconazole is the one on the right there. That's the one that can be used on like vaginal yeast infections. Vaginal yeast infections are common in people who have been on antibiotics just because they're kind of opportunistic in that manner. Miconazole can be put on topically to that. Itraconazole is another azole antifungal that can actually be used with ringworm. So ringworm is one of those special ones, whereas with miconazole, people will get a 7-day, a 3-day, they'll get a specific amount of days for the treatment. Itraconazole is a little different. We tell people to continue with that medication for at least 1 week after the tinea corporis has cleared, okay? Acyclovir is an antiviral. Acyclovir is okay during pregnancy, and if somebody does have active herpes, we do want them to get treated with that because there are specific risks to the infant, and so acyclovir, oral acyclovir is usually used for that, okay? There is an IV acyclovir, but IV acyclovir is kind of dangerous. You really, really have to keep the person hydrated to avoid the adverse effects of nephrotoxicity. It's not 100%, but a lot of antivirals will have VIR in them. If you all have been watching the news over the past year, remdesivir is an antiviral. It's got VIR in the word. So you'll see those words in there. And then that is it, and we wrap up our small section on antibiotics.